Welcome to another episode of Beyond Adjustments, the podcast where we explore the world of chiropractic care, wellness, and why ignoring your posture is basically a long-term investment in regret. Now, let's talk about today's guest. Hang on a second. Dr. Marisa Baumann, the brilliant mind behind Homestead Chiropractic in Bettendorf, Iowa. If you think chiropractors only help with back pain, you're in for a wake-up call. Hopefully not the kind where you realize you slept funny and then kind of can't turn your neck. Anyway, Dr. Marisa specializes in neurologically-focused chiropractic care, which means she's not just adjusting spines, she's rewiring how the body functions from the inside out. We're diving deep into the torque release technique, TRT, why chiropractic care isn't just for adults who lifted something they shouldn't have, and why your nervous system is the unsung hero of your health. Oh, and get this, Dr. Marisa originally started her career in New Jersey before heading to Iowa. I have so many questions, like, was it for the love of the Midwest or was it just easier parking? I don't know. Either way, grab a coffee, get comfortable, and let's get into it. Dr. Marisa. All right.
Hi.
How are you?
Great. Thank you so much for having me. I'm so
I
excited to be here with you.
You think you're excited. I'm giddy. Like I'm so excited. I can't believe you're on my show. I'm really excited to get into this, see kind of where our conversation goes. This is my favorite part of my day whenever I have a podcast recording because I learn so many new things.
Sure.
And no, again, I appreciate you and I appreciate your time. And I'm looking forward to this episode.
Me too.
Yeah, awesome. So let's start at the beginning. So what made you choose chiropractic care? Was it like a lifelong dream or did something happen that made you realize, yep, this is what I'm meant to do?
Yeah, it's not that cool of a story. I actually
Okay.
grew up thinking that chiropractic was a bunch of like hoodoo, voodoo, not something I was interested in. Like, why do you need to get a back cracking? Why would that even feel good? So, not for anything other than I was just ignorant to it. Like I didn't have all the information. And so I grew up always appreciating the human body and the human form. I had intentions of going into like journalism and communications. And then my heart was just singing for that anatomy and physiology. So I ended up
Mm,
directing my career towards health and wellness. And along that path and discovering if I wanted to go be a physician assistant or an MD, I was also a full time CrossFit coach and an athlete. And so participating in athletics and sports, especially as a team, was something I really enjoyed. And obviously, when you're in athletics, you typically experience injury. And I always knew that my body had this incredible capacity to like heal, function appropriately, do what it needed to do when it had the right tools. But this particular injury kind of threw me for a loop and I didn't get better. And so I did all the things that I thought I should do. I went to the ortho, I got x-rays, I got checked out. I even did like dry needling with acupuncture. Like that was pretty out there for me,
oh
but I
yeah.
gave it a
Oh yeah.
shot. So that
Nice.
was the most like kind of deep dive in I went. But, 4 months, 5 months, 8 months later, I'm still dealing with it. I'm not getting better. It's limiting my ability to compete. And so in the gym I was coaching at, there was actually a chiropractor that had set up shop in like a small room there. And he kept harassing me, like, you really should come see me. You really should come see me. I'm like, yeah, 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 whatever. And eventually I gave in and I started to feel better. And not only did my
Mm,
injury start to improve, but other issues that I didn't really consider issues started to improve. I wasn't getting as sick. Had knee concerns and those started to go away. And I was like, wow, this is awesome. And as I started to learn more about chiropractic, I understood that the philosophy I had for the human body actually aligned with the chiropractic philosophy more than it did the medical pharmaceutical system
Mm,
philosophy. And so I
right.
redirected my journey and actually decided to apply to chiropractic school, and I went that following fall. So that's kind of what brought me into chiropractic. And I would say those kind of accumulation of just breaking down, the walls that you think you might have, and
Right.
opening your eyes to something different and new really helped spearhead that.
Gotcha. Where'd you attend school?
I went to the mothership, so I came to Palmer Davenport, where
Yeah.
chiropractic was born. And
Yeah.
there's a lot of really cool places to go to chiropractic school, like
Yeah.
Catskill Mountains or Daytona Beach, Florida,
Yeah.
like South Carolina. But for me, it was like, well, I would buy a plane ticket to go visit those places, but I've never lived in the Midwest. I never visited it. So, in that personal growth, formative years of
Yeah.
your 20s, I was like, I really should probably go live there and experience something new. I had only planned to be here for the 4 to 5 years for school just to move back to New Jersey. And so, obviously, that's a whole other story.
So I get your journey and I get how you kind of what I guess defines your path, right? Your injuries and then kind of expanding your outlook, right?
Sure.
But why is this personal to you? Like, what's your why behind
Mm,
your day to day with your patients?
yeah, great question. Um, my why comes a little bit from a mix of myself and a mix of others. Like, part of my why comes from so much story and experience on the patient or practice member standpoint. I think
Mm,
to myself about the positive things people express when they're under care or when they see their kiddo under care. And whenever I have a tough day, I always go back to, if that family never walked into our practice and experienced the difference and the change, where would they be today?
mm, mm,
And thinking about the multitudes of other people that haven't experienced it yet or seen the difference or know that they're struggling or have dealing with issues within themselves or their family. I'm not a parent yet, but I hope to be. And so I can't imagine what it's like to watch your kiddo dealing with health issues and feeling really helpless or feeling like you're
yeah,
trying all these different things,
yeah.
but nothing is seeming to stick. So it's a little bit of like just the stories and the transformations while also like a little bit of my own inner wounding. Like, I wish someone had been there to advocate for me when I was dealing with this stuff and really
Mhm,
educating me on the understanding because I didn't know the difference. Any time that a chiropractic ever came up, it was just like, yeah, crack your bones, put things back into place, you're gonna
yeah,
feel
yeah,
better. There
yeah.
was never that depth of education, and doctor in Latin actually means teacher. And so I very much embody that. And I want, in this day and age, especially when people are really looking to be advocates for themselves, advocates for their health, they want to know and understand what's going on
Mm,
and why you are doing what you're doing. And so that really brings the whole story forward for me personally. I never want someone to feel a lack of informed choice around what they can do with their bodies and with
mhm.
their health.
Very well articulated. Thank you so much for that. And honestly, just kind of listening to you talk and how you, this wasn't even a question that I told you I was going to ask you because, guys, I do frame these episodes up, but this was kind of something I just threw at her. You could tell it was at the tip of her tongue. So you can see how personal it is to her. So thank you, Dr. Marisa, for that, really. So I want to jump into kind of your practice
Sure.
and the coast to coast situation. So you originally started your career in New Jersey at and how do you say is it Altum? What's the name of the
Altum Chiropractic.
Altum
Yeah.
Chiropractic? So but before launching Homestead Chiropractic
Mhm.
in Iowa, that's a big shift, like both geographically and professionally. Like
Mhm.
what was the transition like?
Yeah, it was a lot of inner transition that led to the outer physical move. So, originally being born and raised in South Jersey and having lived on the East Coast my whole life between Connecticut, PA, and NJ, really that's where my family is, a lot of my, friends and established relationships. And so the intention was always to go to the Midwest, but to go back and serve
Mm,
the community that I left behind and that I so
mhm,
desperately wanted to provide care to. And I did. I set up the practice. We started the process in late 2019 and March of 2020 came along and I was about 3 weeks from our ribbon cutting. And obviously, as you know, what happened in March 2020, they said 2 weeks to slow the spread. Well, that became much longer than 2 weeks. So we did not do a ribbon cutting and we actually postponed the opening of our practice until early July when things started
Oh,
to
wow.
open up in the sense of like gyms were opening and salons
Yeah.
were opening and people were getting a little bit comfortable leaving home again. And so it was during those several months because obviously to have a ribbon cutting 3 weeks away, everything was pretty much set and rocked. I actually even had 2 team members hired that were training. Like we were ready to go. And so during that time, like so many of us, I think we needed to take a moment to really reflect on what was important in our life. And I loved being present in New Jersey with my family, and I was so excited to start this business. But when I actually had to sit with myself and I couldn't really see friends or family, I
Mm,
couldn't operate in the business. What I
mm,
realized was that for a lot of my life, the majority of my life, I made decisions based off of what other people needed
mhm.
versus what truly made my heart sing. And part of this process also involved my significant other, who's born and raised in Iowa, who I met while I was in school. And living in New Jersey as now an adult with her own business and her own life, you're also making decisions about housing and cost of living. And you're no longer in a school or a parental bubble. And I had to make big girl decisions about what real life worked and operated as. And having spent 4.5, 5 years in the Midwest, it wasn't very much a different pace of life in the sense that where I was in South Jersey was very similar to where Palmer is in Iowa. Like the town of Cherry Hill, Haddonfield area is very similar to Davenport, Bettendorf. And so I didn't have like the culture shock that a lot of my Jersey cousins, family, or friends thought that I was going to be out here in the sticks with the
Yeah.
cows and the pigs, you know?
Yeah, yeah,
Um, but it definitely was different. And the cost of living was different and my person was out here. And I realized that being on my own in Jersey really wasn't the same as the time and the love that I had developed for the area of the Midwest, the open space. Cause, 20 minutes outside of South Jersey, I could be in Philadelphia in the city.
for sure.
20
Yeah,
minutes outside of where I am here in Iowa, I'm out with the rolling hills and the
yeah,
cornfields.
yeah.
And I really enjoyed seeing more stars at night and just having those experiences. And so I just told myself, if an opportunity comes along when it does, I will take it and I will move back to the Midwest. And like the universe or God does, when you're speaking and operating more from your heart, things happened a lot faster than even I
Yeah,
expected them to. And I had an
yeah.
opportunity where someone was able to purchase my practice. So we opened it in July. They made an offer to me in October. We agreed on the offer in November. We signed the contract in December, and then the state filed it in January. So I really operated
Wow,
this practice for about 6 months, but I made it
wow.
so turnkey that I was able to sell it for profit, excuse me.
Wow,
This
that's awesome.
Yeah, it was incredible. Such a
That's
beautiful
awesome.
gift, right? This other, doctor and his fiancée at the time, now wife, was able to just come in and continue to operate. Our technique was
Wow.
seamless. Our systems and procedures were similar to how they operated in a prior practice they were associating in, and that afforded me the opportunity that in February, I was already back and moved into the Midwest.
Wow, that's so cool. So what tugged you, what the biggest kind of weight that balanced the scale towards Iowa was your significant other.
Yeah, it really
Sounds
was
like
personal,
yeah,
honestly.
yeah,
Um It just it is true if you aren't secure in yourself, if you aren't secure at home, that will leak into everything you do outside of it. And so my family would recognize this, like, I just didn't have the same shining light that I did when I was in the Midwest and was with my person.
yeah,
And so, obviously such a huge driver, but even if he wasn't a part of the picture, I definitely noticed my heart tugging to go to Tennessee or to go to Wyoming or to go
right.
out to the Pacific
Yeah,
Northwest. Like
yeah,
I was ready to kind of move along, and
yeah,
Jersey wasn't quite what was considered home in location anymore. It was home because of the people and the family and the friends
yeah,
I had. My heart was just calling for something more. My wanderlust was just
yeah,
asking for more from me. And so now I'm here, we're married, we're starting a family next year. Like, life is unfolding so beautifully.
yeah.
Everything that I had wanted then and had rediscovered was actually my calling really came to fruition. So I have
That's
nothing but
awesome.
gratitude for that situation and for the speed that happened as a result of, again, just living more authentically from my heart and discovering really what was tugging on my heartstrings versus what was maybe tugging on my ego more or my need to perform and my
Mm.
need to accommodate other people because that's what I thought that they expected of me.
Yeah. And I fully connect with that. I'm a Brooklyn boy myself. Actually, I moved. I was pulled out of Israel at 7 years old, plopped in New York for many, many years.
Yeah.
So that's what my life was, New York. And there was the same shift. Like it's like I felt God was calling us to another area. I'm in South Carolina now.
Yeah.
And when I first got here, it for me was a huge culture shock.
Sure.
Like, you had a taste. You got to Iowa, you sat there for a few years, you're like, "Oh my god, I can't believe I'm here," but, you blended in and it was
Sure.
very similar to Cherry Hill. My
Yeah.
wife's from North Jersey as well, so, like I get your situation,
Yeah.
but it actually sounds forgive me if I'm overstepping here, but it sounds
We
like a God thing.
Oh,
It
yeah.
it it sounds like he knew that he knew how to get you to where you were supposed to be, and now you are where
Yeah.
you're supposed to be.
I do think back moments because obviously I spent a lot of time back in New Jersey building a whole practice only to leave it. And like, what did that mean? And I honestly feel that if I had stayed here in the first place, thinking that Iowa and the Midwest was where I should go for another person or for something, and never went home to do that. One, I would have always been looking over my shoulder, wondering, should I have gone back? Would it have been better if I was in Jersey?
Mhm,
Two, that could have created resentment in my
mhm.
relationship, in my heart with my family and friends here. But three, sometimes you do need to step off the path you think you're supposed to be on in order to be guided to the one you're truly meant to walk.
Yeah,
So I do believe that there was much more of a universal hand in that for sure.
yeah, yeah. I could stay on the personal stuff for the entire episode. I might actually have to cut some of this out. We've been talking about this for a while, which I love. But I do want to get into a little bit of kind of your specialized care. I want to talk about your practice a little bit.
Yeah,
Um, So you are neurologically focused chiropractic care, right? And that does set you apart from your run of the mill chiropractic office, even though the nervous system is at the end, at the kind of the core of every chiropractic care. But when you call it out, it's different, right? Because so most people think chiropractors just fix backs. I was one of those people, of course, but you focus on the nervous system. Like, what does that mean for patients, and why is that so important?
totally. Great question. It's just going a little bit deeper. So most people think of like segmental or skeletal chiropractic in the sense that
Mhm,
a bone is misaligned or out of place and we need to put it back into place. And so it's
mhm,
like looking at structure, looking at x-ray and saying this is off, this is off. We're going to adjust this bone here and this bone there. And then it's the same adjustment repeatedly because they're just hoping to kind of hammer it back in until you're feeling good and everything's perfectly aligned. Then you
mhm,
have more of like the muscle sports side of chiropractic with rehab. And so you're addressing more soft tissue work. You're doing a little bit more of like advanced PT style work to help, again, facilitate maybe better range of motion, better movement and biomechanics from more of a soft tissue approach, Graston techniques, active release therapy, etc. Red light therapy, Normatec boots, multiple things. Maybe even we're starting to bridge the gap between wellness centers where you have other like practitioners in there that are offering like lidocaine injections or stem cell injections. You're just taking a different approach to the body.
mhm,
Nervous system or tonal focused chiropractic care really is going deeper than the muscle, deeper than the bone to what that protects. Your nervous system obviously is comprised of your brain, your spinal cord, and all the nerves that go out and travel to every muscle, tissue, organ, joint, bone that you have. And they carry messages of function. They regulate all of our organs and our glands. And so if there's an issue at the root, you can soft tissue, stretch, massage, PT, or even just adjust the bone as much as you want, but unless you're really focusing in on those primary areas, it's just gonna come on back. Because again, we often think, "Okay, I'm gonna put this bone back into place." But why did the bone
mhm,
get quote unquote out of place in the first place? Well, bone's attached to muscle. So muscle can either contract and be tight or relax and be either at ease or maybe even in low tone, not performing as well. Okay, well, what tells that muscle to either contract or relax? That's all nerves. It's all signals between the brain and the nerves and the muscle that that's going to. So again, we're just operating in a little bit, we're just going one step deeper into
Right.
making sure that the nervous system is functioning with as much capacity and optimism as it can. So that even the other modalities and things that you do and therapies can be integrated by your system better because everything has to get processed by your central
Mm,
nervous system. Even us having
right.
this conversation is being processed in our brain.
Absolutely. Yeah. No, it makes total sense. Okay, so let's hold for a second
Yeah.
because all right, so torque release technique
Yeah.
to me sounds very aggressive. But from what I understand, Mr. Don't Know Much, it's more gentle, but
Yeah.
it's really powerful. Now, so let's talk about it a little bit. So I won't say it every time because it will twist my tongue. TRT,
Yeah.
we'll just refer to it as TRT. So and it's not the same or it's not the name of like some fancy sports car. No, it's it's which is probably what I thought initially, but it's an adjustment method that's supposed to be both kind of gentle but really highly effective. Like, why did you choose to specialize in TRT? Like, what and then also a follow-up to that, like, why'd you specialize in it? But then what type of patient benefits from TRT? Like, how do you introduce this approach to those who might be skeptical of chiropractic care?
Totally. So let's start with your first question in
Mhm,
Tarkali's technique and how I got there. Even at Palmer, you're getting adjusted as a student by older students because,
mhm.
well, we all need someone to practice on, right?
Sure.
So, as I was getting adjusted and as I had still dealt with like chronic SI stuff or other low back things or injuries from the past, right? Because our bodies are meant to heal, but as we continue to put our bodies through more things,
Mhm.
stuff can come up.
Of course.
And I just never got that full correction, that full restoration until I had an older intern actually come to me having gone to a TRT seminar and said, "Hey, I just went, I learned this new technique. I learned more about the nervous system and tone of the nervous system, dural attachments, which is protective covering around the nervous system that actually anchors it to the spinal column." And they're like, "Do you mind if I try to adjust you in this different way?" And I was like, "Sure, absolutely. I'm interested. Try it out." And upon being adjusted that way, I actually started to see longer lasting change.
Mm,
And then I started to connect with I was like, well, if this is working for me just from a student, I was like, I wonder how it's working in the community with real people and real
yeah,
practitioners that are practicing this way. And so I
yeah.
got connected and I started to dive in with mentors and DCs that were out in the world practicing this method. And when I would go shadow and go see them, one, I saw the longevity of their bodies because it is a very gentle technique on the practitioner as well as on the patient while still impactful. And as a female, like I do want to practice for a long time. And also, if I want to have a family, I want to be able to practice and still serve my community while
Sure.
pregnant. Additionally, the results people were getting, I was like blown out of my mind because even up to this point, didactically learning, we were learning about the body, learning about physiology, etc. We hadn't fully dived in really on the result of the adjustment yet. But I was seeing people make changes, not just in the car accident, neck pain, back pain modality, but really or excuse me, in the neck pain, back pain symptomatology, but really in like infertility, in IBS, in other digestive issues, in
Mm,
sleep, in acid reflux, in high blood pressure,
wow.
diabetes, like all these things that blew my mind. What do you mean chiropractic can help with that? And
Yeah.
so that's what allowed me to really start to dive in deep and go into those places with the nervous system, with chiropractic, and how the adjustment facilitates neurological change and brain orientation change and the system to function better so that the glands and organs were regulated at an improved capacity. I was just like, heck yes, I am all in. Like, this is where I want to go
Yeah.
because I could help people with so much more than just stuff that they could go get help with. And, like, you know, we all can deal with aches and pains, but you got someone that's, you know, about to walk down the aisle and they're dealing with IBS. That is not a fun experience, right? Just definitely a totally different life. And also, you've got a family
Yeah.
that's dealing with infertility. You got a kid that's dealing with autism and the symptoms that can come along
Yeah.
with that and the expression of
Mhm.
that. If there's a possibility that I can improve the way that people are expressing their life, even if that's 5%, 50%, 10%, 75%, 100%, like that's where I want to live. And
Mm.
so torque release gave me this opportunity to address people again from a different manner in a different way while
Mhm.
also not limiting who I could address. So the
Mm.
technique itself is developed out of research of 7 other chiropractic techniques, and it's one of the more tonal nervous system focused techniques. It actually utilizes a protocol checking in on neurological reflexes, specifically the deep tendon Achilles reflex, so the furthest reflex away from the brain, that you really get to evaluate how quickly the signals are crossed over and sent throughout the entire body to the base of
That's
the
so
foot.
cool.
And there, if there's imbalance, right, then there's a disconnect somewhere with that signal passing through quite as fast. And so you'll do like neurological pressure checks to then really see what brings the balance to the body. And then the way you can adjust, obviously, you can use your toolbox, but specifically with torque release technique, part of the research developed a tool that mimicked a toggle release adjustment or a toggle recoil adjustment, which was the first technique developed for chiropractic, in the
Mm.
sense that you had an instrument that fired at 1/10,000th of a second, which helped to beat the muscle response. If you've ever gotten ready to get adjusted, maybe it's a little sore in that spot and you're like, "Oh, I'm a little tight." And your practitioner might say, "Oh, take a breath,
Yeah, yeah,
relax,
yeah.
hold on." And you're like, "Okay,
Right,
I'm letting go, I'm letting go." But that muscle response is there. And if you guard against the adjustment, it might actually not feel as good to get
right,
adjusted. And
right.
so being able to do that and do that with a tool that was extremely specific in where it was going to be placed. And it's a
Mhm.
self like recoil adjustment. So as soon as you apply some pressure, it actually fires on its own. And if people know anything about physics, they know that force equals mass times acceleration. So, in order to get a big force, you can either be really heavy handed and use a lot of mass, or you can be speedy. So, if
Mm.
I can increase the acceleration and the speed of the adjustment while being really gentle, not only do people not have to be twisted in a pretzel if they don't want to be, some people have hesitation about being adjusted, especially when it comes to the neck. That's a whole other episode and a conversation about the safety and efficacy of chiropractic. But you also may have people that are dealing with cancers, that are dealing
Mm.
with bone cancer,
Right,
osteoporosis, other red
right.
or yellow flags. And yes, you need to do your due diligence and make sure that it's appropriate for you to adjust,
Mhm.
but because this technique is more instrument based and is gentler and really focuses more on the nervous system,
Mhm.
I can work with people that maybe wouldn't be able to traditionally go see a more manual or hands on chiropractor.
Right.
And so not only am I able to use this technique in the oldest of grandparents, but I'm also able to use the tool with some of our young mobile children. So it really allows me to
Oh.
stand. And I, again, in my heart, I don't ever want to have to feel like I need to turn someone away that can get care and is appropriately able to accept care. And so being able to provide a technique and a method that allows me to do that and gives me a wider range of scope of change for that person, done. I was,
Yeah. No, I love that. So, actually, I have a question,
yeah.
selfish question. So, there's someone in my life, that is older
Okay.
who, has been suffering from back pain for a
Hmm.
long time. They are in their 70s and has had, back surgeries, 2 actually. The latest one was, and I forget the name of it, but essentially what they did is they kinda shaved kinda the inside of the
A
uh, L it was like L4 and
laminectomy?
maybe. I literally
Just,
can't remember. I'm sure I have the paperwork somewhere here, but so it says they made room for the nerves to kind
okay.
of flow because they were having leg pain and whatnot, and they were seeing
Yep.
pinches there.
Yeah.
Now, I'm not the person that's on the bandwagon of you never need back surgery.
Right.
I'm just not. But I do know that a lot of it can be prevented. Anyway, my question, let's get to that. For somebody who's had back surgery a couple of times, the last one not so successful, would the TRT method be something that they can use to, I guess, be a little bit more mobile, get healthier? Because if so, I'm going to scour the entire South Carolina region for someone or ship him out to, oh, them, well, whatever, to you, but would that benefit them?
Yeah. This is the beautiful thing about, again, why I love this technique. I'll find a practitioner for you. I've got colleagues all over, but
Love it.
we work with people that have had all kinds of surgeries, even fusions, discectomy. So they remove the disc, they put in a filler, rods in their back. So people that have dealt with such severe scoliosis that there are actual physical rods. Again, the beautiful thing about the technique is that you're not specifically like moving bone. Again, you're putting a stimulus into the nervous system to make the body do the movement and the healing and the facilitation itself. And
Mm,
so you are so much more. That patient is so much more than just that one area. And so oftentimes, again, depending on the surgery, they may not be able to get a traditional rotationary or drop or other, again, more manual or hands-on technique.
yeah,
But
yeah,
with torque release or more neurotonal techniques, they can still get adjusted and sometimes even very close to that area. And that's the point, is to improve quality of life, because for some reason there was some kind of biomechanical fault or, physical trauma or some other stressor on the body that led to them needing that surgery or that like modality in the first place. And yes,
right.
sometimes we are at a point where things have gotten to a stage and it's like, yeah, we can conservatively manage this, but there may need to be additional intervention. Even if you do eventually need to get a surgery, and oftentimes, especially if people are coming into our office that have already had, let's say, a fusion, and they're typically maybe because of degeneration. And you're typically told, hey, we're going to fuse this area. But guess what? In probably 5, 7, maybe 10 years max, you're likely going to need to get the areas above or below taken care of too. Because when you
Sure.
stabilize an area and the spine is literally designed and meant to move, now you're going to have other areas that have to move more and work
Yeah,
harder to make up
yeah,
for an area that's lacking. So
yeah,
now you're promoting more possibility for arthritis and degeneration to continue forward. So if we
yeah.
can help improve as much of the biomechanics and decrease some of the physical stressors on the system by your
Hmm.
body operating at a higher capacity, then even if surgery is inevitable down the line, we can help to prolong that process for as much
Mm,
as possible. And the quality of life, again, you just ask someone the question when they're sitting in front of you, just looking for answers. And it's like, what would a 25% improvement to this do for you in your everyday?
sure.
Like, is that the difference between you being able to sit on the floor and play with your grandkids and just
Right,
get up or walk around or be
right.
independently living and caring for yourself? Because
Yeah,
that's when we have our health, like, we want 1,000 things, but when we don't have our health, you only want one thing.
yeah, yeah. No, I love that. All right, I'm gonna be doing some research, but yeah, if you do know somebody in my area, I'll send you
Send me your zip
my
code.
my zip code. I do have several doctors in the area that I'll probably reach out to that I know
Great.
personally, but or even my cyber adjustment network. I'll see what I can find there. But
Perfect.
anyway, thank you for that. I actually never specifically asked about TRT, but because that person was getting chiropractic care,
Sure.
the only problem is it wasn't like an Amazon overnight delivery, right? And I explained to them it's going to take time. There was no patience there. And it was also like, I don't want to get cracked and blah, blah, blah. So maybe this is the solution.
Well,
So,
to speak into that a little bit too, the neat thing about nervous system focused care or torque release technique and other tonal approaches is, again, you're really focusing on the primaries. And oftentimes, where we're experiencing pain is not necessarily the root, but it's actually the secondary compensation. So you
mm,
may go to a more manual traditional chiro and they're listening and hearing about your pains or your secondary compensations and chasing those. And maybe, yeah, you feel good for a little bit after because there's a little less decreased pain. But again,
hmm,
if you're not getting into those primaries that are causing those secondaries to exist, it just comes back faster. So again,
yeah,
the purpose is to really utilize a technique and a protocol that's going to allow you to focus on not everything that needs to be adjusted from A to Z because of all of our pain points, but really what are those primary areas that need to actually be adjusted? What was the first fault that
yeah,
needs to be addressed so that
yeah.
you can experience that change much faster?
I get that. For me, I lost hearing in my right ear, and when I went to the kind of the audiologist and all these other medical facilities, they were telling me a virus attacked your nerves. And when I was talking to my chiropractor about it, he's like, "Your atlas is at like 9 degrees. It needs to be somewhere in the 20s for you, or on average." I'm like, "Oh," he's like, "That actually might be the cause of your hearing loss." I was like,
Yeah.
"There's no way." He's like, "I'm not telling you it is." I'm saying so now I've actually gained some hearing back.
Yeah.
in my right ear, not fully, but he's, I'm using the dental roll and all this stuff. So I get that,
Amazing.
that
Yep,
might be the cause,
exactly.
but maybe, yeah. So, or that might be the pain, quote unquote, but the
Right.
cause might, yeah. So I
Totally.
fully understand that.
Yep.
All right. I'm loving this conversation, and I've never sat so long on each of these questions. This this has been amazing. So thank you.
You're
Your
welcome.
answers have been awesome. So let's talk a little bit about your patient base,
Okay.
uh, because it's impressive to me when you can adjust newborns, you can adjust athletes, you can adjust families, you can adjust, grandma and grandpa.
Right.
Um, that's a big range. And you did mention with the TRT method, you did mention, how you can go from patient to patient. I understand that piece, but I'm sure there's more to that. So how do you shift gears between adjusting a baby 1 minute and then treating an athlete the next?
Totally. It's a great question. And so this is where specialty and extra education comes in because traditionally the torque release method is that you are laying face down on the table with your ankles hanging off the edge of the bench. Well, if anyone has a young child in here or is
Mm,
listening, you know that very likely your
yeah,
kiddo's not going to do that.
right.
And so I've invested in additional training that allows me to understand multiple tonal techniques so that, yes, when we're working with a newborn or a child that's running around our office and isn't going to sit still for me to check their deep tendon Achilles reflex, that we can still achieve, again, a nervous system focused primary adjustment. And so when you're working with newborns and babies, if you've ever gone to a supermarket to buy some mangoes or avocados, you're typically checking to see if they're ripe by gently using your thumb and applying a very small thumb pressure to see if it creates a small indent, meaning that they're ready to go. When you're working and adjusting with a child, especially a newborn, right? So someone that will sit in like a little pillow and hang out with you, or will be on mom or dad or other parent or laying on
Mhm.
you, that you can check them. And it's that kind of sustained contact and very gentle light pressure that works with a newborn. Then you go into another room, yeah, and there is grandpa or grandma in there. And so they are laying on the table, but maybe there's not a lot of range of motion. So you're checking reflexes and you're checking other areas, but maybe they can't get on the bench. Maybe you have someone that just broke their collarbone from a ski accident. This just happened in my practice. And so now they're not able to lay down on the table face down. So
Right.
they're sitting up. Well, again, the nervous system, there's multiple ways to assess it. So it's specialized training, but you can also take temperature side to side to understand the inflammatory differences and see if there needs to be an upper neck adjustment. So you can also
Mhm.
do that with kids that are standing and coloring at a kids table in your
Right.
office.
Right.
So you do have to be just as adjustable, if you would, as your patients are willing to be with you. So I think if someone wants to have a family practice, that flexibility and adaptability is probably the most important thing. And understanding that there are multiple tools in your toolbox for a reason, but there's still an underlying commonality or thread to the way that
Mhm.
you're approaching the system, the way that you're adjusting. For example, especially with a child, especially if you have a child that's very overwhelmed or maybe as an ADHD, like raging bull kiddo, not calm,
Yeah.
not or a sensory kiddo that really can't take in a whole lot of feedback. You're not adjusting everything from A to Z because if you throw the kitchen sink at an overwhelmed system, what's going to happen? Nothing. So you
Absolutely
really need
nothing.
to be
Yeah.
intentional with what adjustments are happening. And again, maybe you're adjusting one, two, max three of those primary areas and then letting that body do what it needs to do and process. Uh,
Yeah.
so again, while the approach or the methodology may be different, the
Right.
philosophy and the baseline approach remains the same.
Yep. No, it makes total sense. So, what
Yeah.
about for like first time patients? I'm sure there's hesitation there, especially like parents bringing in their kids for care. How do you help them feel comfortable?
Yeah. I think a lot of it starts even just with our brand and our marketing. Like, long gone are the days where someone just drives by a chiropractor office and decides to go inside. Most of the time, people, especially if you're a parent that's looking for answers for your kid, are going to look you up online, see if
Mhm.
you have Google reviews, check out your social medias, and see
Of
what your
course.
messaging is. And so we really do like to do some edutainment. So a little bit of education, a
Yeah.
little bit of entertainment, and also just showcase what the ambiance is inside of our practice. And so I think
Mhm.
the comfort starts there. We are not
Right.
your whitewashed walls clinic in a medical building. We're also not your carpet chiropractor that's like in a house somewhere in the downtown area with like a sign that kind of waves in the front lawn. Like I wanted a place that felt very modern. It's true. Like you laugh because you know those places. You've seen them,
It's
you've driven by them. You're like,
I've
are
been to
they
both. Yep.
still in practice?
Yeah, I'm gonna interrupt you because I used to go I used to go
Literally, like there's carpet on the walls, like the Michael Jordan posters are on the wall. Like,
when I was in Staten Island, I went to, like, several chiropractors after an accident. One of the ones I went to, I walked in, like, brown, like,
yeah,
1972, furniture. It was dark, and
yeah,
then there was this one room with, like, fluorescent lights,
yeah.
and I'm like,
It's
I'm
the
I'm scared for my life. Yeah, so
Exactly.
that's why I was laughing because that's where my mind went.
It
Anyway,
wouldn't
go
matter
ahead.
like who you were going to. Like that's just a
Yeah,
sketch situation. Like not the most comfortable.
yeah,
But if
100%.
you're like
Yeah,
a parent bringing your kids or like you're pregnant and walking into that space, you're like, I'm out immediately.
absolutely. Yeah,
So,
yeah,
like, we're in a
yeah,
commercial retail strip. Like, there's all windows. You can see into the practice. There's a little bar set up at the top. We have a hopscotch rug and books and toys. And our front desk is open and it's light colors. And then the
yeah,
rooms, while semi private, have some flow to them. And so
yeah,
you can see everything. We have a sensory room that has sliding doors where you don't have to have fluorescent lights. You can have the plugged in, like, lantern, lawn lights that you might have in your backyard. And so it
right.
feels homey. It feels warm. And then you have a staff that's hired that are people and enjoy helping others feel safe, feel seen, feel warmed and welcomed. You're not walking up to a sliding window where it's like you're there and the person's still looking down finishing their paperwork and then they slide it open. They're like, "Can I help you?" And it's monotone and it's not personal. You're
Yeah,
greeted by name every time you come to the practice. And then we're modern. Like we have technology where people can keep track of their appointments on an app and like move them around because life
yeah,
is unpredictable.
yeah,
Schedules as a family is unpredictable. Sports games are at, 7 in the morning or at 9:30 at night. Like there's just all kinds of things happening. So if you're not willing to be in the service industry, but actually provide a service that feels comfortable, easy, like just any other errand that you or your family has to go through on a regular day, then again, it's just in the approach. It's just in the aesthetic. It's in the vibe. It's in your brand. And
mm,
then once you're actually in the office, it's like, how do we make this as fun as possible? So if you're just a regular adult coming in, we'll typically do the first appointment like all in one go. And so you'll come in, our team will give you a tour of the office so that you know where everything is. You don't have to walk down winding halls wondering where to find the restroom. Like it's all laid out.
yeah,
You'll
yeah,
get to have a consultation with the team. And then we use technology to assess the system so that it's not just, again, oh, point to your pain. Oh, we're guessing if this is the issue. We're
mhm,
actually objectively assessing what's going on. Maybe we'll take digital images to see what the structure of the house that protects your nervous system is. And then you come back because that gives me opportunity and time to really sit with the results of the assessments and the technology scans that we use. We use CLA Insight scans. And so we get to analyze that and like come up with a plan. It's not, again, any guesswork. It's not just come back when it's feeling crappy again. The whole point of you wanting to see change in your health is so that you see change and it lasts, right?
mm,
So let's
mm,
do something because most of the time when people end up in our office, there's momentum to what's already going on. So we have to
mm,
like stop that momentum, reverse it, and send it back in the opposite direction. And that can take,
yeah,
like you said, a little bit of time repetition. If something's been going on for 20 years, one adjustment may make you feel better for 3 days, but it's certainly not
yeah,
gonna correct everything.
that's
If
very
it's a
true.
kiddo or like a sensory kid or a mom with a newborn, we'll split that up. Like we'll do a telephone consult with them so that we just get to chat with them on the phone in the comfort of their home on their own time and schedule. And then we invite them and their child or their family into the office to just have a really fun, enjoyable time. Also, if you're talking about your 8-year-old that's dealing with anxiety and having a hard time focusing and concentrating at school, like a lot of parents would prefer not to talk about the things that are quote unquote not as great with their children in front of
Mm,
their children, right?
right.
This
Yeah,
allows us an opportunity to also candidly understand any parent's concern, whether it's about themselves or their child, because sometimes, obviously, when things are going on with the kiddo, that really affects the whole family unit. And so when they come into the office, then it's just about like having fun and doing the scans, and they get to get stickers afterwards. And it's not a scary experience because there are a lot of kiddos that may have some doctor fear. So that's another thing. Like my team gets to shine in their personality. We don't wear scrubs in the office. Like we're not doing, needles and pricks or prods that we really need to have that kind of barrier. It's fun, it's enjoyable, it's lighthearted. And so we really focus on that on the front end so that the adjustments and the appointments feel really homely on the back end.
Mm, I love that. So I have a challenge question for you.
Please.
I'll let you skip the personal one, but I'm not gonna let you skip this one.
Okay.
So if every listener, which full transparency here, every single chiropractor fails at the challenge questions because you can never come up with like one thing, which makes sense. So let's see. Let's see what you come up with. So if every listener could adopt just one habit to protect their spinal health before, problems arise, what would it be?
It's a great question. I think the biggest thing is move. Motion is lotion, movement is life. If we don't have movement in our neurospinal system, that affects the way that our nerves are going to communicate to our body. If we don't have movement or exercise or are constantly in one position, whether we're sitting at a desk or whether we're standing and serving all day long, we have that repetitive physical stress on our body. So if
Mm-hmm.
there was absolutely just one thing that you could do, it would just be to move.
Mm, love
Doesn't
that.
mean that you have to have a certain way of movement or that you have to do yoga over CrossFit or over this. Like if movement looks like you sitting, but you're pedaling underneath your desk, let it be that. If your movement
Yeah.
looks like you have a standing desk and you have the walking pad, let it be that. If your
Yeah.
movement looks like you get up off the floor, but you can get yourself up again, let it be that.
Yeah.
Just move. Also,
Yeah.
movement helps to numb pain. Like when you activate mechanoreceptors or the movement receptors, that actually turns off the nochi or pain receptors.
Mm-hmm.
And the more you move, the better.
That makes sense. I used to have knee pain, and the more I sat, the more they hurt. But the more I walked around, the less they hurt.
Sure.
So I take that as confusing your body.
Yeah,
Literally, confuse your body. Like if you're sitting in one place, your body thinks, okay, this is what we're doing for the rest of our life. But
exactly.
your brain needs to tell your body to do something else so that, oh, wait, I got to move. So I completely, um,
Precisely. Yeah, you're
yeah,
activating the proprioceptive receptors of your body so that your body can respond more appropriately to your biomechanics and the movement that you need to do that's necessary for you to live your life daily.
yeah, that's what I said. The receptor proceptor septic tank. That's literally what I said. Don't take my words. Anyway, no, you're all good. I'm kidding. It's a great answer. You passed. Okay, you
Thank
passed.
you. Wow.
Yeah,
I
yeah.
feel that's done.
Move.
Interview's over.
What?
It's done.
That's it. Peace out. Later. Oh no, I just did a hand gesture. What just happened?
No, you're good.
Okay. No, it's back now. No, it
Yep.
was like flashing at me.
Oh,
Oy vey. I'm actually gonna keep that clip in here. I need you guys to understand what I've been dealing with this episode.
it's been
I
fun.
talk with my hands. You see how I move my hands? And this camera takes hand gestures and I don't know how to turn them off. Mr. Technical over here.
Sure.
So if every so often you see me like wave at the camera, it's me telling it to look at me. So anyway, all right. So let's get into this next topic here. I want to talk a little about the community engagement and patient education. You touched on it a little bit earlier. Edutainment, I think you called it. So the power of brunch and learn,
Mm.
educating patients beyond the adjustment tables, chiropractic education and brunch. Like I'm in. Where did this idea come from?
I am a product of all the mentors that poured into me before. So most of my things aren't necessarily organic ideas, but adaptive ideas. So I learned from a lot of other people that blessed me with their knowledge and experience. And so the lunch and learn concept came from people doing like health talks or workshops in the community at local businesses. And so they would come in for like maybe 10 to 15 minutes of time. And I did this for other practices when I would shadow or go learn an experience. And you would do a talk with them and bring a treat, right? Because nobody wants to listen to you just because they want to listen to you. So there's a fun incentive in the sense of Yeah,
Of
maybe you
course.
bring lunch or maybe you bring breakfast like in bagels because most of the time, if people are going to allow you to come into their business or into their workplace, it's not going to be at the end of the day. It's going to either be at like a first morning meeting or like a midday lunch meeting or on lunch break, for example. So that's where the brunch, either breakfast or lunch, special treat and learn kind of was adapted for me in the sense that you go in and maybe you're going in and you're going to a banking office or
Hmm.
a realtor's office. And so you're talking about things like reducing stress in the workplace, increasing productivity, and reducing sick days, right? Because that's important, not just for the individual that's working to support themselves or their family, but it's also important to their boss and employer, right? If everyone is
Sure.
pulling out sick because our immune system isn't functioning appropriately, we got problems in a
Hmm.
business. But maybe if you're going to a school or you're going to an autism center and play place, you're talking more about sensory processing and the nervous system and how to make sure that kids are hitting their milestones and developing appropriately and birth trauma, for example. Maybe if you're going to a medical doctor or an OBGYN's office, you're talking about stress on the mother prenatally and what that does and can lead into birth outcomes in the birth and labor process. So you can tailor these educational sessions based off of your audience, which we should all do. And obviously, if there's an ideal client you have, so for me, we do focus a lot on family care, on prenatal health, and on pediatric health. So I oftentimes will go towards businesses that have those as ideal clients so that we can be power partners with each other. Like I have relationships with occupational therapists, physical therapists, speech therapists in the area that specifically work with children. I also have relationships with midwives and doulas that work with the prenatal population. I also have relationships with gym owners that know that biomechanics is really important. It's not just about pain and injury recovery, but it's about preventing them. And so that's why they may appreciate more of the neuro based approach versus a just soft tissue sports massage approach that
Hmm.
my care
Hmm.
can provide.
Right.
So it's about knowing your audience, but being able to tailor an opportunity to, again, educate, because that's what we're meant to do as doctors is not just solve problems, but help people understand what's going on in their bodies and why. And so that's one of the ways that allows us to do that on a broader scale, because also you may be talking to someone that maybe doesn't necessarily need or want your care at that time, but you don't know who they're going to meet in the community that does.
Excellent. So what are like the biggest takeaways the attendees get from these brunch and learns or events in general?
Yeah, I mean, again, it really depends on the topic and the audience. So, when it comes to just like a general talk about reducing stress and like increasing productivity, maybe you talk about movement, you talk about posture breaks or ergonomics in the workplace. If you're talking to athletes, you may talk about biomechanics or proper ways to move the body that are more appropriate for the system. If
Mm,
you're talking about kids, maybe you're offering like more natural modalities. So, like if a kiddo is dealing with ear infections, you can talk about garlic oil, you can talk about different things that can help promote natural healing. But no
mm,
matter what, at the end of the day, you know that again, none of those things can work as optimally as they should if we don't have a high performing and functioning nervous system and body that experiences those things. So, like for us, we always offer an opportunity for them to come into the office to get scanned so that we can objectively measure what's going on in their body and if they need care in the first place.
mm. You answered my I just had a follow-up there. So you do so you're in essence you're giving them practical, not just advice, like you're showing them techniques. You're not just saying, "Hey, this is what we do,"
Yeah.
but you're actually giving them something to take away and actually do on their own if they wanted to. And then you're also offering them a place for them to go to get tests and what have you.
Absolutely. I think that's
Yeah.
important, especially when you get invited into a space. Like, I always want to go there and leave people with something. Plus, if that's what they get from me for free, just imagine what knowledge and experience and expertise they get from me, excuse me, when they're paying for the service, right?
Mhm.
So that's really where we get to then come in and now we're actually doing the adjustments to help them operate and live out the things that we suggested that they continue to do at even a better capacity.
And then you have Q&A, I assume?
Oh, always.
So what's one misconception about chiropractic care that you have to correct at these events?
I think I don't know if there's really just one. I would say kind of the some of the more common ones are about getting like a manual adjustment, getting like a hands-on turning or twisting into a pretzel and safety around that or like why would kids need chiropractic care? And it's like, well, just
Mhm.
go to a park. Like,
Yeah.
if you need to see it, just go to the park. Like,
Yeah, yeah.
everyone's
Yeah.
falling down the slides or hanging
Oh,
off the
yeah.
monkey bars and, like,
Yeah.
rolling on their necks, etc. One of the other ones I would say is probably the most common is like people are like, well, I heard that once you start going to the chiropractor, like you have to go forever. You can't stop. And it's not that people have to go for forever, but
They should.
you if you think that, like, you're ever gonna eliminate stress from your life, like, there are 3
Right.
ways we experience stress. It's biochemical, so, like, air that you breathe, things that you eat, things that you drink, medications that you take. It's physical, right? Just physical stressors in life and even just the natural aging and degenerative process. But then there's also mental, emotional stress.
Mhm. Mhm.
And stress just never goes away. It just shows up looking a little different day in and day out. It's whether our bodies are resilient and adaptable to stress. Plus, when people are investing a lot in their health and they're seeing the positive implications of that, they don't want to stop because they're feeling better, they're functioning
Yeah.
better, experiencing life
Absolutely.
better. So that's why people tend to choose to continue on some kind of like a wellness or maintenance level, whatever that looks like for them, to continue to optimize their daily experience because most people don't want to go back to feeling or functioning the way
Mm.
that they did when it wasn't the best.
I gotcha. So I have another challenge question for you, but
Please.
as I take your advice and confuse my body and move just a little bit, I'm gonna stand up for just a little while,
There you go.
because I'm feeling it. But I have a challenge question for you,
Yeah.
and you have a wide range of options here. I'm not just going to pigeonhole you into something, but if you could give every patient just one piece of advice that could change their lives today, like in the next 5 minutes, what would it be?
I think it'd be more conceptual. I think it'd be more inner. I think it's an identity shift. Like, oftentimes, we are so bogged down with thinking that things are the way that they are and that they have to stay that way forever and that there's no capacity for change. That's probably the most limiting factor that stops people from doing a lot of things in their life, whether it be with their health, whether it be with their employment, whether it be with their family or their significant other and relationships. The feeling that life is stuck and it doesn't have the dynamic capacity to change is such a limiting belief on
Mm,
yourself, your body, and your day to day experience with the world. We often forget that the things that have happened, quote unquote, to us, I like to reframe it as things that happen for us, not to us. But a lot of people think that life happens to them. And those accumulatory life experiences tend to
mm,
create our sunglasses or like our lens that we view what happens in the world. And when we're
mm,
in that limiting place, everything that we experience gets filtered through that same perspective and lens. The minute you can take the lens off and understand that life can be so much more colorful if we're open to experiencing it and doing the inner work to change, your genetics, your identity is so much more than something that you feel or experience in a moment, whether it be an emotion or whether it be a physical ailment. So just understanding the capacity that
mm.
your body, your nervous system has for change and adaptability, I think is something that we could all be reminded on a regular basis.
So running a practice isn't just about seeing your patients, obviously. It's
Yeah.
also marketing, it's the operations, it's probably fixing the Wi-Fi. I don't know when it
Yeah.
goes out.
Yeah. Yeah.
So how do you manage all that? More specifically, how do you balance patient care, the marketing, and operations while maintaining high standards of service?
Yeah, totally. I think one, it's getting very clear on your vision for your business. My vision for my business was that I never wanted to do it alone. So I started both businesses having multiple team members. My first business I had 2, my second business I had 3. And I poured into them and trained them so that they could help me operate the business. I am now in a place where I am starting to scale more up into that CEO of my business role, which gives me more flexibility for marketing, for networking when I would typically be in patient hours. I just hired my first associate doctor that's going to come in the practice with me. So yeah, it's really exciting, but it gives me more, again, opportunity. Otherwise, you have to build your schedule around it. So while I may see patients in certain hour blocks, Monday, Tuesday, Wednesday, Thursday, Tuesday mornings, we always have team training. So we're constantly refining our skills, our systems and procedures, and the way that we want to serve the community with excellence. So we're always holding each other to a standard, and we have weekly check-ins for that.
Mm,
I go out into the community on Fridays, Saturdays, even sometimes on Sundays, and I participate in local community events. We participate in, a park vendor fair and just go out there and educate about the nervous system and showcase
yeah.
the pieces of technology we have. We get together on a Friday morning at 7 a.m. to record Instagram reels and videos for our community to see, so they get to know us and our
Hmm.
brand and our personality and our hearts before meeting us in the office.
Mm,
If Wi-Fi goes out, I've got my contacts list. And if I'm busy with a patient, my team knows who they need to call to help
mm,
improve a situation. And so
right.
you have to create some sort of level of standard operating
Mm,
procedure so that, I mean, you can do it all on your own, but you go further faster with people alongside of you.
yeah.
And so making sure that not only are you leading them well, but you're pouring back into them and you are actually creating a system that they can thrive in too. Because most of the time, unhappy employees come from poor onboarding processes and a lack of clear expectations of what is required of them. And then leadership leaks. So if you're not also doing your own work to continue to better yourself and show up as the leader your team needs you to be, that creates resentment on both sides.
Sure.
Because obviously as a doctor, like, your job in those moments is to be the doctor. So are there things that you can delegate off your plate that maybe you want to do, or maybe it gives you an ego boost because you can do them and you know how
Mhm.
to do them, but
Yeah.
your time is better spent serving the community. So do you really need to answer every phone call or text that comes into your office, or can you have someone helping you to do that?
Yeah. No, that's good because what a lot of doctors that I come across have a hard time with is the delegation
Yeah.
piece. You can't, no matter how hard you try, you cannot be good at everything,
Mm,
despite what I think about myself. But no, but seriously, because you're a great doctor. You're in the profession because you had the right training. Like you know this stuff. That's what you're good at. Maybe along the way you needed to do everything, but there has to come a time where, like you said, don't do it alone because having the right team around you, even if it's family, right? Even if somebody you could bring in a cousin, a sister, your wife, your husband, a neighbor, I mean, whatever,
right.
but somebody to allow you, the DC, the ability to do your job the best way you know how. Because even though you can say, oh, no, I'll get to this on a Tuesday and I'll get to this on a Saturday and I'll get to the point of the matter is you're actually taking up a lot of real estate upstairs. Like even me on the technology side, I can do everything, technically speaking.
Right.
But if I do, that's going to stretch me thin, even though I can compartmentalize things
Absolutely.
because I'm not just a business owner. I'm a father. I'm a
Right.
friend. I'm a brother. I'm a son. I got to do all those things the right way and in
Right.
the right moment. So my biggest recommendation to any chiropractor out there that's either in it for 10, 20, 30 years or just about to jump in, build a team around you. Like even when like if you're an office that accepts insurance, let's just say, far and few between, I get it, it's a mess. But if that's the case, you need to get yourself a medical billing company.
A
Like you need to
100%.
yeah, like all
Yeah.
those things, and I will not touch that with a 10-foot pole, just myself personally. But the point is, building the right team around you allows you to run your operation a little more smoothly. That said, the delegation is huge, right? Maybe you have to hire a marketing firm like mine or
Right.
whatever.
Right.
Um, but the delegation, that's the hardest part. So I have a question for you.
Yeah.
You delegate tasks on a day-to-day basis. Sometimes it's part of your system, which I'm sure you have in place that people just know to do things,
Yeah.
but sometimes you have to let go of something.
Mm.
So what was the hardest thing for you to let go of?
With Great question. I think I continue to evolve in this area, but I very much like, my thing is very much like control or having my hands in every pocket. And so it's just honestly one of the biggest stuff was just the collective, like, day-to-day tasks and things, even team training. So I have multiple team members now. One of my team members is our chief heart officer, and she does a lot of the testing out of tasks that, like, I don't need to be the one to make sure that you can schedule an appointment in our software anymore. Like, My team member knows how to do that through and through, and in fact, is actually the one that does that now on a regular basis. I do not. So there may even be nuances or things that I don't even know about anymore that my team has figured out a more efficient way to do it. Recently, too, over this last year, I actually delegated some of the interview hiring process for new team members.
Wow.
So instead of, I have a three-step process for hiring, a
Mm,
typical phone interview, an in-person interview, and then a working shadowing interview. And so
mm,
I don't do the resume review anymore. I don't do the first touch phone interview. My team member has a list of questions, logistical questions first, and then conceptual, like personality questions after. And they can do that. I can meet them when they come in person. But for me to spend a potential 15 minutes to 45 minutes on the phone with a potential hiree, like my time should be spent out continuing to market us in the community and continuing to serve
yeah.
practice members,
Yeah.
not on the phone vetting
That's
who
good.
could be our next team member.
That's good. That's good. So that brings me to this. So not everybody wakes up thinking, you know what I need today? A chiropractor, right? So how do you get the word out? Like how do you connect with the right people?
Sure. One, for sure, honing in on who your ideal client is. Like, who's the favorite person that you just love to serve? If there were a million of that one person that comes to your brain right now that would make you the happiest ever, that's who you need to be talking to and who you need to
Mm,
be surrounding yourself around. Other people are obviously going to reach out to you. And if you provide a good service, word of mouth is going to travel. And so you will have people that reach out. But I feel like when you get to a position where you also are secure enough in your business that you can be really excited about people coming into your practice and kind of decide on what that is, then you get really clear on who you need to approach.
right.
And so
Right.
there are multiple ways of marketing, and this is the same for any business. I mean, you've
Mm,
got social media advertisements and social media engagement and posting. You also have brunch and learns and lunch and learns and corporate health talks and workshops in the community. You could do
right.
dinner with the doctor where you actually host like an event. You can host and participate in professional networking, chambers, local business networks. You
Right.
could do screenings in the area at craft shows, farmers markets. You could set up in your local grocery store. You could set up at a local gym. You can do one-on-one networking with businesses and other business owners in the area that you want to power partner with. Maybe you come up with a mutually beneficial like referral network with each other. You can do things like podcasts or news media, presentations and interviews if you would. You can do paper marketing. You could send out flyers and put them in the mailbox or postcards to people that live in the neighborhoods or community directly around your place of business. There is so much that you can do. Internal patient referral drives. So, people that are already experiencing the change of your practice, could you run a referral drive there? Run a Google review drive because, again, people will look you up online. So, if
Mm-hmm.
practice members are experiencing positive things, let them share it. And if it's
Mm-hmm.
incentivized, great, as long as it's honest, right? You're not telling people to leave you five-star Google reviews, you're telling them to leave them an honest
Interview.
review.
Yeah.
Why can't you throw them a quick little coffee gift card and put them in it for a raffle for something? Again, you
Absolutely.
never know what that's gonna turn into in the future. So, there are
Yeah.
multiple ways to reach people. You just gotta figure out where your ideal client is looking.
I want to dig a little deeper into that. So when it comes to digital marketing,
Mm,
there's chiropractors out there that are just even businesses in general that will throw out a couple of ads and spend a few $100 and say, "Oh, this stuff doesn't work."
sure.
And I can understand that, but I think that kind of goes back to you need to bring in the right person that knows how to do that because
Mhm.
there is a science behind it. But my question is more related to for a DC out there that's about to embark on this amazing adventure of making a difference in their community and get slapped with reality. How can digital marketing ease that slap, right? Maybe oil up their face a little. But how can digital marketing specifically play a role in helping them one establish themselves in that community or help them grow a little quicker than they normally would? And would that investment actually be worth it for them?
Yeah, I think so for sure. I mean, we live in a digital age, and so people are looking to online to find information. Also, people are really nosy. So if you put yourself out there authentically, like people want to know who's the person behind this business. And people relate to stories and they connect to people that they feel are authentic and actually understand what they're going through. So if you
Mhm.
show up and you speak to their pain points and their story, they're so much more engaged with you. You can
Yeah,
build trust and credibility before they even get the chance to meet you in person. And
right.
people know how to discern like the BS compared to if you are actually showing up and speaking truth, or like if you're showing up and reading from lines on a script back and forth,
Yeah,
like you speak from the heart. Doesn't mean you might not
right.
have facts you want to share with them or specific, talking points, but
Yeah,
they'll see it, they'll get it. And again, showcase yourself. Show them what the office will look like. If it's pre-opening, tell them about all the things that you're doing. Give them the pre-opening opportunity or special to come meet you in person. Say that you're going to be set up at such and such coffee shop for the next 3 hours.
yeah,
Come hang out and have a coffee with me. Meet me. And you can do that by reaching people online. You could have an Instagram or a Facebook live. And then if you start posting content, digital marketing agencies can help to get that out to reach. But yeah, it
mhm,
does take more than just you throwing a couple $100 behind one post. If you have a
mhm,
digital marketing company that knows what they're doing, they're going to be targeting
mhm.
your specific demographic, maybe even doing tracks with like who's actually clicking on your website, who's coming from Google. How do we target those people that have already started to engage with your content so that
Yep,
they're seeing your stuff more and more? Because people typically need to see things several times before they invest in it.
yeah,
So that's, I think, where the digital marketing age really will thrive and can be a
yeah.
true benefit to you and your practice, but only if you're showing up for it.
Yeah, 100%. And my advice there would be, if you're concerned about the price tag, let's set it aside for a second. Do something. Create yourself a couple social pages or focus on one. Let's just say focus on Instagram, right? That seems to be one of the more popular for chiropractors. Let's focus on Instagram and make sure you create your GMB or your kind of your Google My Business location. Make sure that you do that and fill it out completely. Throw a couple pictures up there. Like, do something that will at least create a footprint for yourself digitally,
Mhm.
and then of course get your website out there. So if again, if it's the price tag, I understand that. And yes, digital marketing is expensive if it's done right, but the return on your investment is there for sure.
For sure.
Now, initially, my first recommendation, it's so simple. It's so simple. One, don't overthink it. Think about that one person that you want to reach, just like Dr. Marisa was saying, just that one and speak to them. Put a 30-second post out there, a minute. You want to teach about something? 3, 5 minutes. Like, don't overcomplicate it. And even if you're in your car and you have a quick thought, post it. It's really that simple. And the more you do, the more traction that you're gonna get.
Absolutely.
So yeah, that would be my advice there. But I have a question for you now, specifically, Dr. Marisa, and your goals in your practice, maybe.
Yeah.
What's one like huge, ginormous goal that you haven't achieved yet, but are determined to reach? And what steps are you taking to get there?
Mhm. I mean, hiring my first associate doctor is a big one, but I definitely foresee us being a practice where we have 3 full-time doctors at any given time. So,
Wow.
my goal for that is for that to happen at the end of this year. I'd love to have another doctor hired, especially as, again, I get into more of a stage of my life where I'm also exploring, like, family life, etcetera. But my biggest, most hairy, audacious goal is
Yeah.
to change the way that we think about chiropractic, especially in this community where chiropractic was born. Again, chiropractic has come so far, and it's
Mhm.
not just about insurance based neck pain, back pain, car accident stuff. There's so much more. And this day and age, people are looking at the
Yeah.
vagus nerve, they're looking at the nervous system, they're seeing the trajectory of health in our kids and all this stuff that they're dealing with, the stuff that we're experiencing as adults. And I really do want to blow people's minds about what natural healthcare can truly look like at the root.
Love
So
it.
that's the big, hairy, audacious, internationally acclaimed, blazed path make it clear and showcase it to the world.
Yeah, love it. Well, I'm standing behind that because I think that the more people learn about what chiropractic care actually is, uh,
Yeah,
and it's not just the ambulance chasing situations.
for sure.
Um, just like how unfortunately a lot of lawyers get a bad name because there's ambulance chases. It's the
Right.
same thing with the chiropractic industry, but with chiropractic, I mean, it's been around for what 130 years.
Yeah,
The advancement that we've seen
totally.
in this time is insane. The medical industry has been around way longer,
Mhm.
right? And for me, the exponential growth of chiropractic care and the benefits of it outweighs your traditional medical any day, in my opinion.
Medicine is so important, and we see, like, how much medicine has advanced and is truly there and can absolutely save lives. I say that
Absolutely.
chiropractic helps to restore. 'Cause
Mm,
if your body doesn't have the capacities to support itself, you will be reliant on some other intervention for the rest of your life. So
hmm.
how can we help set up that system so that if medicine and further intervention is something that's necessary, because it is in some cases, and if I'm ever
Yeah,
stuck in a trauma situation, I am so thankful that I am here and have access to incredible medical doctors and companies and hospital systems. Like we're blessed. But how do we make sure that we are restoring our life, experiencing our life in the best way
yeah.
possible, conservatively managed before needing to immediately either go under the knife or have pills and drugs be a part of our story indefinitely?
Yeah, I agree actually 100%. Not to discount the medical industry, but there's a place for it, like you're saying.
Absolutely. Place and time.
Um, yeah, and I always say God doesn't make mistakes. He designed our bodies in a way that they would heal themselves, and chiropractic care gets your body in that place.
Totally.
I actually also always say that chiropractic care does not heal. It just gets your body into the place where it will do what it was designed to do from the beginning. So, anyway, great answer. Yeah, I wholeheartedly agree. There's definitely a place, and we have the best healthcare system in the world, in my opinion, comparatively.
Yeah.
But yeah. All right. Well, this time has been amazing. I do need to start closing out, unfortunately, because we're probably losing some of our listeners at this point. But I have a question for you. What keeps you excited about this work day in and day out?
It's the stories, it's the people we serve, it's the mom of the autistic 3-year-old that tells me that for the first time, her kiddo laid down with her, snuggled her, put a hand to her chin.
Oh,
"I love you, mommy. You're my best friend." And this has been a nonverbal kid. It is the couple that has been trying for 6 years to get pregnant and can. It is the athlete that has such an identity wrapped up in their performance, and they get back to doing the marathons that they needed to run even though they have a labral tear. Like, it's that. It's the facilitation of the difference that that makes in their life. It's the
mm,
expression of life that a person is able to have that really just, again, reminds me on the toughest days why I show up to give and serve in the way that I can.
mm,
It's always about them. And even sometimes when the results, right? Like, not every story is this beautiful story of sunshine and rainbows in health and healing. There can be a lot of mess in the healing journey. And
mm,
sometimes it's just about, like, the appreciation of the fact that we held space and that that person felt listened to. Because a lot
mm,
of times people are dismissed. Pain is subjective, some symptoms are very subjective, and we don't always believe the person. And so being able to actually be in a profession that truly does listen and understand that every person's experience is important and what
mhm,
they're going through matters to them and affects their daily life, that just awareness and compassion and empathy can sometimes be just as healing as the facilitation of the adjustment later too. So
mm.
that's really what keeps it moving.
I love it. I love it. Great answer. And yeah, for when a child has those milestone moments when you thought that you would never see
Yeah.
those moments, that's just huge. I love that. Wow. Okay. So, all right. How can our listeners get in contact with you? So if somebody raises their hand and says, uh, Dr. Marissa, I want to learn more. I want to book an appointment. Uh, where can they find you?
Yeah, absolutely. For our office, definitely check us out on Instagram at Homestead Chiropractic. My personal page is dr.marisa.nicole10. I also have a podcast about doing the inner work with a colleague. So that's for entrepreneurs that are wanting to show up as better leaders. So you can follow us at the Heartwork Podcast. But that would be probably the easiest three ways to get in touch with me or my team.
Excellent, excellent. And I'll have all of your details in the description wherever anyone is listening. So make sure that they can contact you. I'll have your phone number, your website, all that fun stuff to
Perfect.
make sure that they can get a hold of you. And then final question. If listeners could start just one small habit today that would improve their health long term, what would it be?
Go to the chiropractor.
Ah, great answer. Yeah. Go to the chiropractor. Get yourself a
Go get assessed.
yes. Yes. I love it. Great answer. Well, Dr. Marisa, thank you. I really enjoyed my time with you today.
Well, thank you. I enjoyed it too. Appreciate being on here and getting to share and chat.
Awesome. Thank you so much. Well, this has been amazing. Again, Dr. Marisa, thank you for sharing your expertise and really convincing me that my nervous system and hopefully everybody else that's listening is probably out of alignment. So we need to do something about it. But for everyone listening, if you're in Bettendorf, Iowa, do yourself a favor. Check out Homestead Chiropractic. And if you're not in Iowa, well, maybe it's time to plan a road trip. I don't know. I might. We'll see. But if you enjoyed this episode, make sure to subscribe, leave a review, and share it with that one friend who insists their posture is fine, but you can literally hear their neck crack every time they turn their head. Ugh. Until next time, take care of your spine. It's the only one you've got. See you in the next episode. Cue that music.